Thank you for joining us for the exam and spinal exam help video. The exams will be set up for your office during implementation. It holds all of the findings when examining the patient. The user can access all the exams created inside ehrTHOMAS on the left side of the screen. Search for a specific examination in the search field. Click the WNL button to indicate that all examinations are within normal limits. Click the Clear button to clear all examination findings from the exam. Click the Category drop-down box and select the appropriate category to show the examinations that have been categorized. The examination list can be sorted by caption or sort order. Click the Sort option drop-down box to sort it. Click the Sort button to sort the examinations in ascending or descending order. The examination list will show the examinations that are in the category that is selected. If the WNL button is grayed out, it means that the exam does not contain any defaulted WNL finding. Click the examination on the list to highlight it to access the examination. On the right-hand side will display the available options for the examination. There are a few different layers inside each. The first is the headers. Second is the buttons, and the third are the specific questions. As you input information into an exam, the name will show a green checkbox. Visual information will populate under the exam name. The gear represents how many headers. Box represents the number of items, and the flag represents the findings answered. The headers are expanded, but to collapse all the buttons, click the Collapse button. All the buttons are specific to the header. They can be set up two ways, with or without drop-down menu. If the button does not have a drop-down, three things can happen. A user input screen, a question screen, or a green checkbox will be added to the button, which means there is information inside it. If it's a user input button, it will only ask to enter text or a number as an exam finding. Click Accept or Close to complete the entry. If the button initiates a question screen, the user needs to answer questions for certain sentences to pull into the note. Not every question must be answered if it doesn't apply to the patient. Each question may have multiple answers. Quickly find the answer by typing it in the Filter Answer search bar. Some multiple choice questions will have an Add on the Fly option, which will allow the user to type in a multiple choice answer if the option doesn't exist on the list. This answer will only be used for that encounter. Sometimes a question screen will yield an image question. All points will be listed on the screen's left side. Selecting a point prompts the user with additional questions about the location. In certain scenarios, the point can be used to indicate multiple locations for a finding. Click the Mark Image button to mark an image. The points on the image will disappear and the Mark Image button will change into a Stop Mark button. You can now draw on the image. Click on the color to change the color of the pen. The color selector screen will appear for you to select a color from the palette. Click OK to use the color selected. Change the pen size by using the Size button, which will bring up the line size screen. Type in a higher number to make it thicker, and then click Accept. Click Stop Marking to finish drawing on the image. All marks can be cleared by selecting Clear Marks. The Save Copy checkbox will automatically be selected when the user begins to draw. This will save a copy of the image and add it to the end of the note. If the exam button is a scoring assessment, each question with a multiple choice answer will have a value associated with it. As you answer, the values will be totaled, provide you with a score, and what your score means under a certain range. When all the findings have been selected, click Save. If the button has the arrow icon, then it had a drop-down menu. Clicking on these buttons will prompt the user for additional options. The button is asking the user to select WNL or findings. Selecting an item will give you options similar to when you select a button with no drop-down menu. The examination review screen allows the users to review the selected examination items and give access to edit the information developed. This screen will also display possible diagnoses, as well as the ability to add any additional diagnoses. Click on Go to Review to access the examination review screen. This screen is based on the exam you select. On the screen's left side, the highlighted exam indicates which exam you're in. The middle of the screen is where all findings can be easily reviewed. Any buttons with a green checkmark on it will show on this screen under the appropriate header. Genius Solutions does not recommend that the WNL button to be selected from this screen, since it only allows users to edit and delete items. Each answered button will have its own box under the appropriate header. Click the Clear button to clear a specific system that has been completed, or remove the entire finding. Click the Collapse All to collapse all questions and the Expand All to expand all questions. Click the Additional Assessment Questions button to complete additional assessment questions related to the specific exam. If there is no drop-down or selections, you can't edit that answer because the information is pre-populated. If a finding was entered using a user input screen, you only have the ability to edit the entire finding. Click the Edit button to do so. If a finding was entered using the question screen, you can edit the entire finding or re-answer the questions. Click the Edit button to edit it, and click the Re-answer Item button to re-answer the question inside of an item. This screen's right side allows users to add a diagnosis to patient's active condition list, allowing the examiner to review the information and add in conditions. Genius Solutions does not recommend to add diagnosis codes from this area. The spinal exam module is only enabled for our chiropractic databases. This screen was specifically designed to incorporate data a chiropractor would use. Spinal findings can easily be visualized on every vertebra. The first time you enter the spinal exam, it will be blank. The buttons on the bottom right corner allow you to see the full-size image of the spine, zoom into the image, zoom out, and zoom to fit the entire screen. At the top of the screen are general findings for a spinal exam. Select the appropriate findings. The severity is noted by color. Green is none, yellow is mild, orange is moderate, and red is severe. The up and down button indicates if the severity is increasing or decreasing. Muscle findings can be noted as superficial or deep. Single-click the appropriate severity for each finding. Click the appropriate areas of the spine where the findings are applicable. Clicking a vertebra left of the two blue lines will indicate the finding is located on the left side of the vertebra. Clicking on the right of the two blue lines indicates the findings are on the right side of the vertebra. Selecting one in between the blue lines indicates the findings are bilateral. When an area is selected, it will be highlighted. Unselect the location by selecting it again. Apply all findings to the location, clicking on Apply. Findings for a vertebrae group will be located on the left side under the Findings header displayed on the spine. Repeat the process to add more findings. Modify a group of vertebrae by clicking on the Group Findings, which will highlight all of the vertebrae on the screen and reload the findings at the top of the screen. Re-answer the appropriate findings and click Apply, which will change all of the findings for this group. Click the Remove Findings button to clear all findings. Click on the desired locations to be modified. The system will attempt to reload the findings at the top if the findings are consistent among all vertebrae. Re-answer the general findings, then click Apply to change them. Clear the selected findings by clicking Clear Selected. Click Save to save all the spinal findings, and click Cancel to exit without saving. If you need additional help or have further questions, please call the Genius Solutions ehrTHOMAS Support Department at 586-751-9080, option 7. Thank you.